Drug-induced fever is a rise in body temperature that occurs as a side effect of certain medications. This condition can be alarming for patients, but understanding its causes, symptoms, and treatment is crucial for effective management. Recognizing drug-induced fever early on is essential to prevent potential complications and ensure patient safety. By understanding this condition, patients can take proactive steps in managing their health and communicate effectively with healthcare providers. Drug-induced fever is a relatively common adverse drug reaction that can affect individuals of all ages. It is characterized by a fever that develops in response to the administration of a specific drug, usually within a few days or weeks of starting the medication. The fever is not caused by an infection or any other underlying medical condition but is directly related to the drug itself. Understanding drug-induced fever is important because it allows healthcare providers to make informed decisions about the patient's care. In some cases, the fever may be a mild and temporary side effect that resolves on its own, or with simple measures like over-the-counter fever reducers. However, in other cases, drug-induced fever can be a sign of a more serious underlying reaction, such as drug hypersensitivity or organ damage, and may require immediate medical attention. The diagnosis of drug-induced fever can be challenging as it often mimics other febrile illnesses, making it difficult to distinguish from conditions like infections or autoimmune disorders. A thorough medical history, including a detailed list of all medications, is crucial in making the diagnosis. By understanding the potential for drug-induced fever, healthcare providers can consider this possibility when evaluating a patient with an unexplained fever. Drug-induced fever can arise from a variety of mechanisms, often involving the complex interplay between medications and the body's immune system. One common mechanism is hypersensitivity reactions, where the immune system overreacts to a drug, perceiving it as a foreign invader. This immune response leads to the release of inflammatory substances that can trigger fever. Another mechanism involves drugs directly affecting the body's temperature regulation center in the brain, known as the hypothalamus. The hypothalamus acts like the body's thermostat, maintaining a stable core temperature. Certain drugs can disrupt this delicate balance, leading to fever. For instance, some medications can interfere with the production or action of neurotransmitters involved in temperature regulation. Drug-induced tissue damage is another potential cause of fever. Some medications can directly or indirectly damage tissues, leading to inflammation and the release of inflammatory mediators that cause fever. For example, certain antibiotics can cause liver damage, while some chemotherapy drugs can damage the lining of the intestines, both of which can result in fever. Furthermore, certain drugs can trigger autoimmune reactions, where the immune system mistakenly attacks the body's own tissues. This immune system misfire can lead to inflammation and fever. For example, some anticonvulsant medications have been linked to drug-induced lupus, an autoimmune disorder that can cause fever, joint pain, and other symptoms. Lastly, some drug-induced fevers occur due to idiosyncratic reactions, which are unpredictable and not related to the drug's usual action or dosage. These reactions are often rare and poorly understood, but they can lead to a range of adverse effects, including fever. Recognizing the signs and symptoms of drug-induced fever is crucial for early detection and intervention. While fever is the hallmark symptom, it is often accompanied by other telltale signs that can aid in diagnosis. These symptoms can vary depending on the drug involved, the individual's sensitivity, and the underlying mechanism of the fever. One of the most common symptoms is a high fever, often reaching 102 to 104 degrees Fahrenheit or 39 to 40 degrees Celsius or higher. The fever may develop rapidly or gradually and may be persistent or intermittent. In some cases, the fever may be accompanied by chills, which are intense episodes of shivering that occur as the body attempts to raise its temperature. Skin rashes are another common manifestation of drug-induced fever, particularly in cases of hypersensitivity reactions. These rashes can vary in appearance, from mild, itchy red spots to severe, widespread blistering. The rash may be localized to the area where the drug was administered or may be generalized, affecting the entire body. Fatigue is a common symptom associated with many illnesses, including drug-induced fever. Individuals with drug-induced fever may experience a general feeling of tiredness, weakness, and lack of energy, often accompanied by a decreased ability to perform daily activities. In some cases, drug-induced fever may also present with relative bradycardia, a condition where the heart rate is slower than expected for the degree of fever. This is in contrast to most infections, where the heart rate typically increases with fever. Other possible symptoms include headache, nausea, muscle aches, and joint pain. These symptoms can be vague and nonspecific, making it even more challenging to diagnose drug-induced fever based on symptoms alone. Therefore, a comprehensive medical evaluation is essential for accurate diagnosis. Section 4. The Diagnostic Puzzle, Identifying Drug-Induced Fever. Diagnosing drug-induced fever is complex, requiring thorough medical history, clinical suspicion, and exclusion of other causes. No single test exists. Timing of fever and medication history are crucial. Discontinuing the suspected medication can help confirm the diagnosis. Section 5. Combating the heat treatment strategies for drug-induced fever. Treating drug-induced fever typically involves a multi-pronged approach, focusing on discontinuing the offending medication, providing supportive care to alleviate symptoms, and addressing any underlying conditions or complications. Prompt and appropriate management is essential to minimize discomfort and prevent potential long-term consequences. The cornerstone of treatment is discontinuing the suspected medication, as this often leads to the resolution of the fever within a few days. However, the decision to stop a medication should always be made in consultation with a healthcare provider, weighing the benefits of the medication against the risks of the fever. In some cases, alternative medications with a lower risk of causing fever may be available. Supportive care measures are crucial in managing the symptoms of drug-induced fever and improving patient comfort. These measures may include rest. Adequate rest allows the body to conserve energy and focus on fighting off the underlying reaction. Hydration. Fever can lead to fluid loss through sweating, so staying hydrated by drinking plenty of fluids, such as water, clear broth, or electrolyte solutions, is essential. Fever reducers. Over-the-counter medications like acetaminophen or ibuprofen can help reduce fever and alleviate discomfort. However, it's important to use these medications as directed and avoid exceeding the recommended dosage. Cool compresses. Applying cool compresses to the forehead, neck, and underarms can help lower body temperature. In more severe cases of drug-induced fever, hospitalization may be necessary to provide intravenous fluids, monitor vital signs closely, and administer medications to control the fever and any associated symptoms. If the drug causing the fever was being used to treat an infection or another serious condition, alternative medications will need to be considered to manage that condition while avoiding the drug that triggered the fever. This often requires careful consideration and collaboration between healthcare providers to ensure the patient receives appropriate treatment for all their medical needs. Section 6. A stitch in time. Preventing drug-induced fever. While not all cases of drug-induced fever are preventable, several strategies can help minimize the risk, particularly in individuals with a known history of drug allergies or sensitivities. These strategies focus on enhancing communication between patients and healthcare providers, promoting medication safety, and raising awareness about potential drug reactions. One of the most crucial steps in prevention is providing healthcare providers with a comprehensive medical history, including a detailed list of all current medications, both prescription and over-the-counter, as well as any known drug allergies or sensitivities. This information allows healthcare providers to make informed decisions about medication choices, considering the individual's risk factors. Medication reconciliation, the process of reviewing all medications with a healthcare provider at each visit, is essential to ensure medication safety and prevent potential drug interactions. This is particularly important for individuals taking multiple medications, as the risk of drug interactions increases with the number of medications being taken. When starting a new medication, it's generally advisable to start one medication at a time whenever possible. This allows for easier identification of the culprit drug if any adverse reactions, such as fever, occur. It also allows the body to adjust to the new medication gradually, potentially reducing the risk of side effects. Monitoring for symptoms of drug-induced fever, such as fever, rash, chills, and other associated symptoms, is crucial, especially when starting a new medication. Patients should be educated about the potential for drug reactions and encouraged to report any unusual symptoms to their healthcare provider promptly. In some cases, Genetic testing may be available to identify individuals at increased risk of certain drug reactions. These tests analyze specific genes that play a role in drug metabolism and can help predict an individual's likelihood of experiencing adverse drug reactions. However, genetic testing is not available for all drug reactions, and its use in clinical practice is still evolving.